This is the section you'll be graded on. Everything you've learned so far, the why, the gear, the veins, collapses into one 6-minute window where an examiner watches your hands and ticks boxes on a sheet. The NREMT Roman 4 Therapy with Fluid Bolus skill sheet has 16 scored points and a short list of mistakes that fail you outright, no matter how well the rest went. So we're going to walk that sheet in order, the same order you'll perform it. Learn the procedure as the sheet is written, and you don't have to remember a sequence twice. The skill and the test become the same thing. Picture the start of the station. Your equipment is laid out, the examiner reads you a scenario and the clock starts. You have 6 minutes and up to 3 attempts to hand them a patent, properly running line. 16 points are scored across the run, and they fall into 3 natural blocks. Set up, getting fluid and tubing ready before you ever touch the patient. The stick itself, the worth 5 points heart of the sheet, and finishing, securing, adjusting and observing. Notice how much happens before the needle. Most candidates who fail the time limit lose it fumbling the bag and tubing, not on the vein. Points 1 through 4 are pure preparation, and they are easy points if you narrate them. Point 1, check the fluid. Hold the bag up, read it out loud. Write solution for the order in date, crystal clear, no floaters or cloudiness. If it's wrong or you can't vouch for it, you've contaminated your own care. Point 2, select the appropriate catheter for the patient and purpose. Point 3, select the proper administration, set macrodrip for a bolus, microdrip for a controlled line. Point 4, connect the tubing to the bag. Slide the protective cap off the port and spike it without ever touching the piercing spike. Point 5 is where you purge the air, and it's the one beginner's rush. Hang or hold the bag upright, then squeeze the drip chamber until it's about half full, half not flooded, because you need to see the drops fall to counter rate later. Now open the roller clamp and let fluid run the full length of the tubing, bleeding every bubble out the end, then close the clamp. Air in the line is the seed of an air embolism, which is a failing error. Point 6 can happen any time before the stick. Tear your tape now, while you still have 2 clean hands, so it's ready when you need it. Point 7 is small, fast, and one of the easiest ways to fail the whole station. Take and verbalize PPE precautions before the venipuncture. Say it. I'm putting on my gloves and eye protection before I make the stick. This is a critical criterion. If you puncture skin before you've taken and stated your precautions, the sheet is over regardless of a perfect line. On this exam, thinking it isn't enough. The examiner can't score what they can't hear, so make a habit right now in practice of speaking your safety steps. Gloves and eye protection on, stated aloud every single time, before anything sharp comes near the patient. Now the patient. Point 8, apply the tourniquet, the constricting band, about 4 to 8 inches above your intended site. Snug enough to engorge the veins but never so tight it kills the pulse below it. Point 9, palpate a suitable vein. Feel for it, a good vein is springy and bounces back, not a hard cord and not a pulse. Point 10, cleanse the site. Most protocols want a circular motion from the center outward, and the rule after is absolute. Once it's prepped, don't touch it. If your finger drifts back to repalpate clean skin, you've contaminated the site, and you must reprep before you stick. Here is the heart of the sheet, point 11, worth 5 of your 16 and worth saying out loud as you do it. 1. Insert the stylet, bevel up, distal traction on the skin, about a 35 to 45 degree angle. 2. Watch for flashback, that splash of blood in the flash chamber, and say the word flashback, because that's a scored verbalization. Drop the angle, advance, then thread the catheter off the needle. 3. Occlude the vein with a fingertip just proximal to the catheter tip, so blood doesn't run out as you withdraw. 4. Remove the stylet. 5. Dispose of it in the sharps container immediately and say so. Stay on that sharps point, because it's a critical criterion of its own. The blood-contaminated needle goes into the sharps container immediately, at the point of use, not set on the bed, not parked on a tray for a second. Verbalize it, sharps to the container. Then keep moving down the sheet. Point 12, release the tourniquet, and remember, a line that won't run is often just a band you forgot, so this is also a save. Point 13. Connect the tubing and run the Roman 4 briefly. Open it up for a moment to prove the line is patent. No swelling, no ballooning under the skin, fluid flowing freely. The last 3 points finish you cleanly. Point 14. Secure the catheter with tape you tore earlier or a commercial dressing, and loop the tubing so an accidental tug pulls the loop, not the catheter. Point 15. Adjust the flow rate appropriately and know which one the scenario wants. A fluid bolus runs wide open to push volume. A TKO or KVO line, to keep vein open, runs at a slow trickle just to keep the vein from clotting. Point 16. And pure words. Verbalize that you'll observe the patient for the desired effect and for adverse reactions. Say it and your 16 points are complete. Now the criteria that fail you no matter how clean the rest looks, burn these in. You fail if you don't deliver a patent, properly adjusted line within 3 attempts inside 6 minutes. You fail if you don't take and verbalize PPE before the stick. You fail if you contaminate equipment or the site and don't correct it. You fail on technique that risks uncontrolled hemorrhage, a sheared catheter, or an air embolism. Which is why you never pull the catheter back over the needle and never leave air in the line. You fail if you don't dispose of the contaminated sharp immediately. And you fail if you stop managing the patient like a competent EMT. The skill is the easy part, not failing is the discipline. So that's the whole sheet top to bottom. Prepare, protect, stick, prove, secure, observe, 16 points and the short list that ends it early. Practice it in this order until it's muscle memory, and say the 4 things out loud every time. PPE, flashback, sharps and observation. Next section we go deeper on indications, contraindications, and the complications that turn a good line bad. Everything to read more on for this section is on screen.